Hey everybody, this is our first DSM Live. Sloan, our esthetician for the day. She's going to do a HydraFacial for Nicole, and Lindsey will be coming in. She'll be doing Botox for us. So, Sloan, if you want to explain basically why someone would choose a HydraFacial as opposed to, let's say, just a traditional facial.
Okay, well, in this day and age of smartphones and smart homes and smart cars, it would make perfect sense that we would have a smart facial. The traditional benefits of a facial, extraction, exfoliation, replenishment, all of that leaves the skin and returns to baseline within 5 to 7 days of the treatment. But with a HydraFacial, you get ongoing results. We treat the cells deep down, and that targeted treatment allows for those treated cells to rise up as the skin turns over and continue showing results. So we've washed Nicole's face. We're going to protect her, and we're going to protect her clothes, and then we're going to begin our HydraFacial.
A question that I get from clients is, will the results be immediate or will they be cumulative?
So it's a little bit of both. With the HydraFacial, you get traditional facial results such as the exfoliation, the replenishment, extractions if need be, but after the treatment, you continue to see the benefits of the targeted therapy.
So, now Sloan is going to start the treatment. She'll sort of take you step by step and show you what she's doing. She'll tell you what she's doing. Nicole, how are you feeling?
Very relaxed.
She looks intense. She's happy. How does it feel? So when she's doing this part of the treatment, again, people ask me this all the time, how does it feel? And I explain it strangely. I'm like, it's like a little shock vac for your face, and everyone has their own explanation. So how do you personally feel when it's happening to you? How does it feel?
It just feels like a little suction cup.
Yeah. So exactly, like a little shock vac. It's like now that portion, that sucking, does that take the place of manual extraction?
So what we're doing right now is actually a refined exfoliation and cleansing. The exfoliation comes from this cool little vortex fusion tip, and then we are infusing the skin with salicylic acid, antibacterial, nice for cellular turnover, as well as glucosamine. Glucosamine's neat because it softens the dirt and the debris in the skin, so that when we get to the extraction stage, she gets a much finer result without having to traumatize the skin at all.
So Nicole, like if you look at her skin, you can see that she has awesome skin
because she's been doing HydraFacials.
Yes. She's really good at maintenance. So we have, when I did my first one, I had like some peeling, which you told me would happen. My skin hadn't been turned over in years, and so when someone is kind of coming in fresh and what can they expect versus the maintenance stage where Nicole is, where she has like beautiful skin that she's just maintaining?
Well, if the environment's not healthy enough, you will get a little bit of cellular turnover, no question about that. It turns over because it needs to go. So there's a certain amount of self-acceptance there. But usually, once you've adjusted, once you've acclimated, you just get the benefits of the therapy itself with not a whole lot of drama to the skin. So we've moved on to the second stage of the HydraFacial. This is the targeted treatment. This is a totally customizable stage to the therapy because right now we're working with the standard glycol, that's 7.5% glycolic, 2.5% salicylic. Passed through the epidermis and targeted deep down, it actually increases the potency of the peel, making it the equivalent of a 30% chemical peel. No major trauma to the skin. You can, however, increase those acid levels, bringing it up to a 70% chemical peel. Now, if I applied 70% chemical peel to Nicole's face, she would have to hide out for a couple of weeks, and she would lose sheets of skin. And maybe that's great for an overall rebuild, but we know that we can actually target at low levels and still get the same reaction with ongoing use. But if you have a real medical condition, cystic acne, real problems of the skin, it's actually really nice to have that flexibility so you can get more results in a shorter period of time.
Does this facial ever change? Like, are you doing it exactly the same with the same products in exactly the same way for someone over the course of their skincare regimen, like let's say over the course of a 5-year period, or even age-based? Is it changed, or is it one standard way to treat with this particular facial?
Well, so we did the standard treatment with the glycol. However, you can customize your serums at the next stage to give a refined treatment. Now, in the case of what we're demoing today, the 50-50, which is a combination of the HydraFacial coupled with Botox, we will actually be incorporating some derm builder, which is a variety of peptides. They also act to disrupt the neurotransmitters, sort of acting as an onset to the Botox while the Botox sets in over the course of the 3 days. So you get a really refined treatment coupled with the Botox. It also, with all this suction going on, increases the circulation, which means a better retention of the Botox.
Which is, kind of brings me to my next question. So everyone asks me why these treatments are so much better done together. And also the question of downtime is, like, even with a facial, people ask me, like, can I go straight to work after I do the Hydra? Of course, people want to come like on their lunch break or something. They want to know, so is there downtime?
This is a great lunchtime facial, in fact. We just did the extraction stage. Now, usually with a traditional facial, there's a lot of poking and pressing and sometimes breaking of the skin. So what we like about this is that we soften the dirt and debris, and then that's shot vacuuming it right out of your skin. If it's not coming out at that stage, we may do some refined extraction, but if it's not coming out, it means the environment is not healthy enough for that sort of thing, and that's where people usually go wrong at home. They traumatize their skin. So at that stage, we increased the suction levels, we did slow drag over Nicole's face, and any impurities, which she does not have many, have been gently removed. At this point, we're going to go back to our specialty serum. We had talked about using the derm builder specific to her Botox appointment, but there is also a Brightenol, which is our butane, designed to brighten any brown spots, stubborn areas, or brighten them post-laser therapy, where you've been specifically trying to correct that, and this refines the process. And then there's also our growth factor, which, should you have textural issues in your skin, it can be coupled with other therapies, just a traditional facial even, or our collagen induction facial. But this is really nice if you have a little bit of scar tissue or just old acne lesions, to fill them in and stimulate the regrowth of the collagen and the elastin. So Nicole's working with our derm builder. I know that while Nicole's a very happy person, we want to just correct these stress areas. Right, Nicole?
Yes.
So we're just doing a very slow absorption of the product right there. And as I said, it's a premature disruption. It works prophylactically with the Botox by just sort of disturbing that transmission, that stress factor, while the Botox sets in. The other area for that is oftentimes, right around the crow's feet, and then occasionally the lip line.
Does that feel the same every step, Nicole?
Yes.
So the suction you don't feel different, it just continues to feel kind of the same throughout?
Yeah, it feels the same throughout the whole treatment.
Yeah. Does it feel relaxing to you? Sometimes people ask me when they hear machine, like they're like, is this going to feel like not as relaxing as a regular facial? Does it feel relaxing?
I do like it. I think it is relaxing. It feels kind of like a tingle on the skin.
Yeah.
That's nice.
And I like the hum of the machine.
Mm-hmm.
It's like white noise, like a baby.
It is. Nicole actually mentioned the tingle. We're working with a lot of active acids, and for some people that can be a little bit shocking to the skin. That's where you get that cellular turnover, the flaking or the sloughing. Her skin is well adapted to it, so even the high potency peel portion she'd do just fine with. If there was something beyond a stingle, as we call it, we will neutralize whatever's sitting on the surface of the skin. But this patented vortex fusion allows the product to sort of press past the epidermis and target the deeper cells where they develop, like the basal cell layer. And we're at the last stage, and this is actually the most beneficial, because at this point, we're pressing deep into the skin. Vitamins A, which is great anti-ager or pro-ager. Vitamin C, which is a nice brightener to the skin. Vitamin E, which is a lipid. And then hyaluronic acid, which holds 1,000 times its own weight in water and is something that actually exists in all of our skin. However, we start losing high percentage points of hyaluronic acid as we age. And that's when dehydration sets in, and once you become dry, the deeper tissue becomes dry, gravity takes its toll, and you get that laxity of the skin. So we're going to saturate Nicole at this point as if she were a sponge until her skin really can't take any more. And so we know we've built up layer upon layer of this perfect cocktail that is really designed to not just improve cosmetically, but create a really healthy environment. So in addition to the therapy she's about to receive with Lindsey, she just has a more resilient, healthier skin that can tolerate, in these parts, your cold winters, your outdoor and sun-exposed summers, and whatever else might come her way.
All of these like vitamins and serums and all of this, you can also have your home care regimen kind of mirror what you do here, and then in between your facials you're maintaining this so that you're not like starting from scratch every time you get a facial.
Right. Some vitamins work better for some conditions, like a vitamin C for somebody with lots of discoloration in the skin. But everybody should be on some sort of vitamin A derivative. Really just works well as a pro-ager, helping you age gracefully. It creates a thicker epidermis and just a sturdier, healthier skin. And so we can customize, of course, based on any cosmetic conditions or concerns that a client may have. But overall, our recommendation for a healthy environment is always a combination of A, C, E, and hyaluronic acid, increasing levels as you get older.
As a baseline for most people.
For most people. And the trick of it is that when you have healthy skin, when there's a healthy environment, those other conditions sort of manage themselves, you know? Creating a healthy environment, well, then you may have the added benefit of losing that patch of brown skin or that surface discoloration because your skin's just turning over at a more normal or a faster rate, which is the objective as we get older, and improving surface imperfections just because it's more resilient and it's more tolerant.
Which makes sense when you say it, but I swear to you that it's like you kind of have to hear it. Because I wasn't aware of half of these things before being here, and you know, I'm better now, and even now, of course, I learn every day. But so Nicole, when you started did you start getting facials young, or when did you kind of begin taking care of your skin?
I started probably in my young 20s, but I lacked until probably my early 30s, and that's when I started getting the HydraFacials. I prefer it over any other facial.
I mean, you're really compliant too with your like home care regimen, right? You like do your products, you kind of do it religiously.
Yes, you learn once you get a facial, you have to maintain it home and keep up with your facials and your home care. Otherwise, it defeats the purpose of getting the facials.
Well, Nicole works in the dental industry, and it's amazing how many people assume that skincare is any different. Because if you go for your dental cleaning, but you don't brush your teeth or floss in between, it really does not serve you any benefit. And it's the same here. You've just invested money and time into a therapy designed to correct your cosmetic concerns, but if you don't go home and take care of your skin, we are not magicians. We're here to sort of walk you through the process, give you the information that you need, aid you in getting to the result that you want. And these devices are amazing, but it still comes back to how you maintain your skin, how you feed it the way you feed your body, really listening to it. If you've gone out in the sun, for instance, then, you know, going in for an acid treatment is not something I would do for you. don't go home and do it either, you know. You gotta pay attention and learn what your body or what your skin, your largest organ, is asking you for, and treat it accordingly. And because Nicole really understands this, she's our favorite type of client. She's compliant, she comes in, yeah, we love you,
I
Nicole.
love you guys.
We love our compliant people.
But she gets results, and it's a cyclical relationship here. It's a symbiotic relationship, because she gets her results, so she comes back asking for more, but one does not work without the other, and it's
Right,
really
everybody's
nice when you have that.
Also, I'm asking so many questions, but if you guys have questions, send us your questions. We will answer them, or by we, I mean Sloan will answer them. I will ask them and you will answer them.
Well, that's the beauty of Dream Spa Medical. Even if we don't have the answer off the top of our heads, between our 100 years of combined experience at our facility, we'll find the answer. And then that becomes a point of research and a point of effort for us. And the beauty is we don't hold it a secret just to build our own personal business. We love to share it as a company. So any provider that you speak to here has the information somewhere within this data bank that is Dream Spa Medical.
That's true. We love our people. Everyone will tell you that.
We do.
We love our people.
And we love to give them dual therapies. So one of our favorite combos is the 50-50. I have done my 50% portion of this. So now I'd like to introduce you to our Nurse Injector, our NP, Lindsey. She's an educator. She's
Hi, guys.
the best professional. And of all the treatments I've
Nicole's
ever
excited.
received, probably one of the best injectors I've ever met. So, yeah, of
One of the
course.
best estheticians I've ever met.
Thank you.
All right,
All right,
squeeze on
I'm gonna
by.
move on out.
Okay, how you doing,
Nicole,
Nicole?
Enjoyed you.
Yay.
Good, you're
Nicole,
ready
are you
to,
excited?
I am.
Are you
Okay.
excited, Lindsay?
I'm always excited to do
Oh,
what I do. Very
You're
fun.
so good
It's
at
not
it.
going to be as relaxing as what Sloan just did for you, but you'll have some
She's
good
super
results.
excited, right? Are you excited?
I am.
Yeah. Everyone loves this combo because it's like the facial is relaxing, but the Botox obviously is everything. That's what we're
I like
all
to
waiting
say it's not too bad though.
No, it's not.
No, I mean, no one comes out crying, correct?
No, not yet
never.
in my
They
experience.
come out smiling every time.
Yes,
So-
everyone's pretty happy
Tears
about
of
it.
joy.
Tears of
Tears
joy.
of joy. So
Yeah.
before you start with her, maybe explain to people the difference. Internally, we kind of know the difference, but the difference between Botox and filler.
Yeah.
Just to debunk all those questions that people have about that.
Yeah, very common question. So Botox, which most people are familiar with, right, is an injection that goes into the muscle. Botox is actually a protein, and basically it relaxes the muscle. By relaxing the muscle, the skin tightens. Tight skin looks better, feels better, right? And actually it's healthier.
And you said it sort of trains the muscle, like
Yeah.
to not do the things you don't want it to do.
Right,
over
so
time.
Botox is a neurotoxin, and by injecting it into the muscle, you know, I don't really want to use the word paralyze, but to a degree it does paralyze, meaning more so like relaxing the muscle. Depending on how many units of Botox are given, that's what decides how much the muscle is relaxing. So we have control over, you know, how much movement the muscle's going to have after a Botox injection. You don't have to have zero movement. I like to tell all my
Right.
patients that just because you have Botox does not mean your face is going to be like plastic.
And people have
Yeah.
different preferences.
Yes.
So some people
Absolutely.
like a certain amount of movement on a certain part of their face or a lack thereof, and
Right.
depending on your assessment and what they've asked for is how you decide how many units to use. I'm
Exactly.
assuming.
Exactly.
Just filling in the blanks.
You're so good, Jenny.
For you.
The best. Absolutely. You know, as far as looking natural, you know, it's also the patient's perception of how they look natural. So my job really is to understand where the patient's coming from and what they hope to see, you know, what they're expecting from their Botox. Adjustments can always be made. The great thing about Botox actually is that it's not permanent. However, if you're consistent with it, if you're maintaining maybe like every 4 to 5 months, you can in the future have long-term results. The muscle atrophies because it's weakened by the Botox. When a muscle's not
used
working,
to not moving.
Yeah.
Like if you were like
Exactly.
laid up in bed and you
Mhm.
didn't move for months and months, it would be hard to move.
right, you'd have to go to
Right.
physical therapy and train that muscle to start working again. And that's the same with the muscles on your face.
That makes so much sense. I've never heard you say it that way before. I'm learning, people.
It's always good to
walk us
understand,
through.
yes.
So of course we would
Yeah.
always treat symmetrically, but I'm standing here. You will treat her on the right side, of course, and then
Yeah. Yep, that's
yeah,
fine.
you just assume. Just walk us through the treatment.
Mm-hmm. Well,
don't
I also
have
want to
to-
quickly answer, I didn't get to the filler side of that question. But we
Do
can
I?
talk about it here, as I'm assessing this
Yes,
patient.
let's.
So fillers are injected into the skin and or on top of a bone. It sounds kind of scary, but it's not. Fillers, for the most part, the ones that we use are made of hyaluronic acids. There's nothing in the product except for hyaluronic acid and lidocaine. Lidocaine just simply helps to make the process, the procedure, a little bit less painful. For Nicole, for instance, if we were looking at Nicole's face, right, her complaint to me is, what would you like me to fix, Nicole? What do you think?
Filler or Botox?
Either, on your face, on your face.
Probably more volume in the apples of my cheeks,
Mm-hmm.
and then Botox in the forehead and around the eyes.
Okay, so what is it that you think that the Botox on your forehead is going to do for you?
Help prevent with further wrinkles and lines.
Mm-hmm. Right, exactly. So for Nicole, everyone's structure is different. So as far as her being used to Botox and consistent with it, she is. She's a good patient. She has no issues as far as, tolerating the Botox. She likes the feeling of it. As far as tolerating Botox, some people like the feeling of a lot of Botox and some people like the feeling of a little bit of Botox. Because she's a consistent client of mine, I know exactly what she wants. So we've already got that covered as far as how many units I'm going to give her of Botox. When she talks about the apples of her cheeks, that's obviously a request for filler. For her, the best filler for Nicole would be something called Voluma. Voluma is a hyaluronic acid filler made by Allergan. It's a great filler. It's injected onto the bone, and basically, we pull the skin back and inject into the bone. It sits on the bone, and over the next couple of days after injection, it spreads and kind of connects to itself, and in that process, it's lifting and volumizing. So really nice, safe product. I'm not going to do that for you today, just for the sake of time, really. I'm going to show you my Botox injections on Nicole. And
Over time,
yep.
you'll see all our treatments. Is the thing.
Yeah.
So tune in.
Tune in. Okay.
Ask questions.
So, all right, let's get to the Botox for Nicole.
All
Nicole, I want you to squint and smile for our crowd. Yes. All right, so we're looking over here with these little lines, a little harder. Squint. Yeah, there you go. Yeah, you see, she's getting some.
She's pissed.
She's getting, Nicole is getting some long-term results. Her muscles are starting to get trained by Botox. She used to have, a little more crow's feet showing here. But we're going to maintain her results by injecting into this muscle it basically circles around the eye. I'm just going to give her 12.5 units on each eye. It's going to go directly into the muscle, which is super, super thin, and just barely away from the eye over here, an inch away from the orbital bone. And then raise your eyebrows, Nicole. All right, so we've got some good movement here. However, because of Botox, she's pretty smooth at rest. Do you agree?
Yeah, completely.
Yeah. So over time, if she didn't do Botox, raise again, those lines would be visible
Permanently there.
at rest.
Yeah.
Exactly. I'm going to lay her back a little bit for her
Okay.
injections.
I think that you are good on that side.
Yeah. I'm going to just lay her head back just a tad bit here. All right. And then one more expression for the crowd. Make an angry face. This one, a lot of people come in for that guy.
The suspense is killing us.
We call it all different things. The 11s, the angry face. Some people call that their scowl or frown lines. Where, you know, I consider frown lines down here, but we can fix this. This is an easy fix, people. If you have this problem, come see me. There's no need to have a line here. Perfectly smooth, very easy treatment to do that spot, as is the rest. And then when we do all three areas together, it looks really nice.
The trifecta.
The trifecta. Okay, so here is the Botox. I've already pulled the Botox up into a couple syringes. So you guys know out there, Botox actually comes as a white powder in a vial, and you reconstitute it with bacteriostatic saline. So it's actually a liquid that we're injecting into the muscle.
It just doesn't come as a liquid.
Exactly, right. And then as the saline gets absorbed, the Botox is then stuck to the fibers of the muscle, and that's when it starts to activate. It could be anywhere from 4 to 7 days. Sometimes people do need the full 2 weeks. It's not that I would say the average is probably 4 to 7 days for it to kick in.
Which is why we recommend the follow-up. It's
Exactly.
important because people have one feeling the day of, and they need to allow the product to get to its full, efficacy?
Yeah.
You know,
That's a good point, because some areas may take a little sooner than other areas, and sometimes all of a sudden on day 10, boom, your Botox is there kicking and shining and looks great.
Yeah.
So we don't do touch-ups before, 12 days. I would say most people are happy a little bit before then, but if it takes you 12 days, no big deal. I don't think there's any, rhyme or reason to it as far as why does it kick in sooner for some people and not for others. My personal experience, maybe age has a little bit to do with it. The younger clients with, who are newer to Botox may respond a little bit quicker, but that's not always the case. All right.
Okay.
So Nicole, here we go with your
Ready?
crow's feet injection.
I'm ready.
I'm gonna come to the side here, all right, and you're familiar with this, but our crowd may not be. Close your eyes, and I want you to squint and smile. Good, and relax. So I'm feeling the orbital rim here, okay? And I'm going to do one out here just because I know that her crow's feet extends that wide, even though it doesn't look like this, which is also probably because of the awesome HydraFacial she just had.
Yeah.
So, I mean,
And each person will
yeah.
be treated differently. By treated, I mean injected in
A little bit,
different-
yeah. The injections can, they vary a little bit per person. Of course, everybody has different foreheads,
Right.
right? So, I want you to make an angry face. All right, let's take care of this guy. Tilt your chin up a tad. The first injection is going to go into the middle muscle, called the procerus, okay? 1, 2, 3, boom.
I love the technical jargon. FYI.
Awesome. And then we've got 2 corrugator muscles. These are shaped like almonds. Everybody has different sizes of corrugators. Make the angry face. Hers, yep, relax. She needs 2 injections. 1, 2, 3.
Nicole taking it like a pro.
Yeah, you see a little blood here and there, but not much. As far as, bruising is minimal. It can happen.
Right.
Anytime you stick a needle into somebody's skin, they
Right.
could bruise. But,
So the Occumend patches are used when in terms of bruising?
I love Occumend patches when I do deep
She
injections.
perked right up.
Yeah. I find that they work really well. For like Voluma is
Yeah.
a filler like we talked about. It's injected deeper onto the bone, and sometimes that could cause a little bit more bleeding. So the Occumend patches, it's kind of like a holistic approach to minimizing bruising.
And
it does work.
even
It does
for
work. Yeah.
situations where you aren't sure, it's nice, like prophylactically, to
I'm
do
just
that.
holding
Like
the
if people
Botox
need to go
upward
to
a
work, you want to make
Yeah.
sure, like nobody wants to be bruised,
Right.
or whatever.
I mean-
so at least you have that, and it's like an inexpensive option in terms of
It is.
not having.
Does anybody have an occupant patch that we can show the crowd what it looks like? Also,
Our crew's gonna get us an occupant
Yeah.
patch.
Might as well show you guys. But yeah, I have a lot of patients coming in for all kinds of injections, and they tell me, hey, I got an event tonight. And I'm like, okay,
We're gonna patch you up.
pressure is on a little bit, but we can minimize bruising as much as possible. I like my patients to walk out of here not looking like they were injected.
Yeah, I get,
I
I get like no feedback, very minimal. I mean, if it happens, it's very rare. Do you want me to open this or you?
It's okay. I mean, well, yeah, you might as well.
Open it?
Open it. While you're opening that, I'm gonna finish her glabella, the area between her eyebrows, which
I need my
again is
crew.
made of 3 muscles. Here we go. I'm gonna have you tilt up your chin, good, and relax, make an angry face. And again, this muscle here. 1, 2, 3, relax. Okay. What do you think? How you doing?
Good.
Not bad, right?
No?
These little mosquito bites, they'll be gone in a few minutes.
You can't even see them from this
Yeah.
angle.
Yeah.
Yep.
So it's mostly red from my pressure, but also, like I said, the saline increases the size of the muscle, but just temporarily. Saline gets absorbed really fast.
So now that you are, you will do this side when I move
Oh
away.
yeah,
But-
yes. We're not going to do Botox on one side of the face.
For
But I have
today,
some patients that need that.
Yeah.
It
right.
can be done, but
So-
not for Nicole.
So we're gonna wrap it up. We're gonna,
Yeah,
yeah,
we can wrap it up.
something
Sure.
else?
I mean, if I were to do the forehead injections, same thing that you guys have been seeing, but every patient's a little different, just depending on their forehead and where their muscle is the strongest. So for Nicole, it's up here, up high. She has a pretty safe, easy forehead. Yeah. Good for teaching.
Yes.
I'm an instructor, so hence why I'm teaching.
Yeah.
But yeah. Any
All
other
right, guys,
questions?
thank you for tuning in.
Mm-hmm.
We will be doing this periodically. We will give you a heads up when we're doing it. Thank you, Lindsey. Thank you, Nicole. Did you have a good time?
Yes.
We'll finish treating you when we're off air. Bye, guys.
Bye, guys.